So today, on behalf of the Health Committee, and being a Sunday, 17th of August, the year 2024, we are going to briefly have a few facts on M-Pox. Those of you who have seen on the media, it has been very frequent. It's now an alert. And so we'll talk about the monkey pox viruses. And up to the year 2022, it was monkey pox. But since November 2022, it's now called M-Pox. So wale wanapea majina the diseases, they changed from monkeypox to M-Pox for reasons we are not going to discuss here. Now, as monkeypox, it is called monkeypox because it was first identified in monkeys in the year 1958, but the first case was not on until 1970, and this is the friend who was the rhesus monkey, is the one that was first identified to be the cause of monkeypox. Since then, of course, other non-human primates have been identified to be the cause of that, and squirrels and the others, but we'll concentrate on the rhesus monkey itself. We are not going to discuss what it is, but if time allows, we can discuss. Now, the geographical distribution of M-Pox is usually the forested areas in Central and Western Africa. This is where the disease is endemic. But in as much as it is endemic, currently there is an epidemic in Central African Republic and also the Democratic Republic of Congo. If I give an analogy of the same, in Kenya we say malaria is endemic in Lake region and the coast. But you also hear sometimes that there is an epidemic there, is when the peak has gone beyond the normal endemic rate. Now, in last month on 29th, I think it was the night of 29th, a case of M-Pox was confirmed in Kenya at Taita Taveta, Tanzania border port. And that is the first case that has been confirmed. But since then, there has been a suspected case in Mbobaz sub-county in Kisii. There is a lady who thought that she was having the virus and presented herself in a clinic, but the case is still being investigated. Then the other day, 16th is when? Saturday or Friday? Whichever date it was 16th. Another suspected case was identified in Keno, Muranga, but the case is now being attended at the Level 5 Thika Hospital. So today, that's why we are giving that alert. I know some of you may have seen it through the media, but today, for those who haven't, we want to take advantage of taking you through what this is all about. So this is just an alert. It has not yet been declared epidemic in Kenya, but we should be on the lookout. So how is M-Pox transmitted? There are two cycles for the M-Pox, and one is between the animal and the human being. And this is when there is close contact, especially during hunting, and also exchange of animals, especially in Western Africa, where people buy monkeys and the others. And when the animal is being skinned, so that handling makes it possible for you to contract the disease. The other cycle is human to human. And human to human is direct. You don't need something in between for you to get the disease. And so this is through the fluid that comes out from the papules or the blisters that form after you have presented the phase 2 of M-Pox. You could also get M-Pox through contact or handling soiled material, either intentionally or unintentionally. And I know some of us we are used to hijacking other people's jackets and shoes and all those other things. That's a way that you may also get the M-Pox. Then there is also the issue of the sexual contact, and this has been the case especially in European countries where this virus has passed. It has mainly been passed through one person to the other through sexual contact. But again, unlike some other viral diseases which you inhale and acquire the infection, for the M-Pox, it's more of droplet infection. Now, ordinarily when you are speaking, when you are talking, the saliva in very fine droplets is released. And these contain a lot of viruses that if they come across the other person who is probably looking at you with the mouth open, then you contract the disease. And so that's why we are saying that when, especially now, if you are not sure, when you are talking to the other person, you look at them with your mouth closed or you look the other way. It is even the virus enjoys better, especially when you are quarreling. When you are quarreling, there are some of you who spit. You don't even do droplets. You release a lot of saliva, and in the course of this, the virus is just dancing hallelujah. Now, once you have been infected and the virus has gone through your system, what are the clinical symptoms? What is seen in you? Now, we should note, first of all, that there is an incubation period. This is a period when the virus is going through your system, finding out whether it is going to succeed or not. If after the 2 weeks your immune system is okay, then the disease disappears. But after 2 weeks and the disease progresses, then you present with phase 1 of the disease, which is you ordinarily flu-like signs. And those of you who have suffered from flu, you know the sequence of events. From chills, you'll have headaches, you'll have fever, but fever in M-Pox, like some other viruses, is not regular. It is irregular, or what we may term as intermittent. If you have a fever in typhoid, if you have fever in malaria, it has a very regular phase. But in M-Pox, it is not regular, and that's why we are saying that it is intermittent. Then, as the disease continues, you suffer from joint and muscle pains, and beyond there, not beyond, but towards the end, you come up with sore throat. But then the body openings are not spared, because you will have the rash in the mouth and especially the tongue. Look as if you are suffering from a fungal infection. Your anus will be affected. You can imagine when when you have the virus and you have the rash in the anus, what happens? Then also the genitalia is also not spared. So it is every part of the body. When that fluke-like period is over, then the phase 2 comes on, and this is now the production of the rash. Now, the rash starts as just simple pimples on the face. They are itchy, and some people may probably just assume that it is just something that either an insect or something else that has passed through your face, but this is what happens. But within 2 weeks, your whole body is rashed. You have rashes all over, as I have just mentioned. And sometimes the rash can cause even blisters, as we are seeing in that presentation. Unfortunate thing is that even the palms of your hands and even the soles of your feet are not spared. And you can imagine you cannot touch, you cannot step. I don't know what you need to do. You cannot lie. Then unless you, of course, you hang yourself so that you stay suspended. So once that is done, then how do we diagnose the M-Pox? Now here I'm just saying that it is important not to self-diagnose some diseases. Unless you have a wound which you are seeing you have cut yourself and you know that's a wound. Because sometimes we assume a lot of things. And that's why we are saying the diagnosis of some of these diseases is confined to the labs to give a definite diagnosis. I'm saying this because you may be suffering from chicken pox. It will still give you rash. You may be suffering from cowpox. You still have those rashes, but the management is different. The vaccination is different. Now, having said that, for our purpose, how do we prevent the disease? It is known that one of the major contacts in human beings, especially in Kenya, are the hands. We like shaking hands except watu wa dini ya Msabwa. Those are the ones who only do this. Very often, when we meet, even the people you don't know, you want to greet them. And sometimes someone has already taken your hand and is shaking it because that's a tradition or a culture that we have. So that's one of the areas that we need to look at, the shaking of hands. But if you have to shake your hand, as I've just said, then after, I know some of you believe in washing after use. But we are saying that this time you wash before use, and so you do the hand hygiene. And we have talked about the transmission, so you should also avoid brushing against other persons who may be suspected to suffer from the disease. And because whether it is through the oozing, the clothing, or through the skin, you should be able to contact the disease, and that's why we are saying don't do that. So what are we saying? We are saying that in case you find yourself having these signs, and especially when you have a flu after a few days, then we are saying that you actually need help. And the help you'll get is you attend a health facility, and they'll advise you the next move to do.